Grateful to be here. Trevor Colhoun, based in New Orleans, Louisiana, founded TPN.health. We are a digital marketplace of about 45,000 licensed clinicians nationally. We allow organization partners such as treatment centers to connect into our network of clinicians or engage with their own individual network digitally by either providing continue education live on demand or in person, being able to track and train their own clinicians on their licensure or credentialing. But at the end of the day, we're a massive database of clinicians and engagement process for the entire behavioral health community to digitally engage.
Wonderful. See, I told you guys, all-star panel. This is gonna fly by, but we will leave some time at the end for questions. So if you're listening online, if you're with us in person, know that we'll have some questions. So Trevor, I wanna start with you really talking about, I know, the importance of networking, which I feel like is the cornerstone of what we've been doing this week, right? Learning from one another, also understanding that we're not on an island, we're all in this together, and we have shared opportunities as well as shared struggles. Can you talk a little bit about the importance of networking and what that looks like for the work that you all are doing?
Yeah, I mean, I think everybody sees that networking's important. That's why we're all here. We have a completely different process and perspective. Without kind of hiding the ball, we're developing and to have developed a process where you as a organization, you as a clinician can engage with tens of thousands of clinicians and understand what networks of payers they're involved with, if they're licensed, not licensed, what services they provide in terms of modalities, interventions, but more importantly, as a treatment center, more specifically, we allow treatment centers in a year to engage with about 10,000 clinicians annually. So really changing the process of the old game as we look at it as treatment centers start to market, build their brand, build their connectivity of going to conferences and maybe engaging with 10 to 30 clinicians at that conference to being able to do one event and engage with 500 clinicians. Show their inside of their clinical practice by doing a continue education, continue to engage with those clinicians and build relationships digitally. When we think, I was interesting, there's a panel yesterday at about the same time yesterday. They were talking about treatment centers spending $50,000 a month on social media or paid or SEO and saying that it was a dip in the pool of a red ocean and not being able to get any kind of exposure. I thought that was fascinating because we at TPN changed the game of networking in terms of cost and how far you can take your engagement and process and really change that from an analog world to a digital world.